Hello students, today we will discuss about autoimmune disease. Let's start with the introduction. Normally, the function of immune system in our body is to recognize foreign elements and to destroy them before they could harm us, either by humoral immune response or cell-mediated immune responses. Thus, the immune system defends the body against infections and certain other diseases by identifying, attacking, and destroying the foreign substances. Sometimes the immune system makes a mistake and starts attacking the body's own tissues or organs, which is termed as autoimmunity. An autoimmune disease is a case of mistaken identity resulting in failure of the immune system to differentiate between self and non-self components, in which the body reacts against its own constituents of tissues. So, by the definition, autoimmunity refers to the body's development of intolerance of the antigens on its own cells. That is, there is an immune response to one's own tissue antigens. This type of body response results in a disease state characterized by a specific antibody or cell-mediated immune response against the body's own tissues, that is, autoantigens. So, we can say that autoimmunity is the breakdown of mechanism responsible for self-tolerance and induction of an immune response against components of self. Any disease that results from such an abnormal immune response is termed as autoimmune diseases. The immunological mechanism of the body is dependent on two major factors. First one, the inactivation and rejection of foreign substances, and the second, the ability to differentiate between the body's own antigens, that is self, and foreign, that is non-self. It is not yet exactly what causes the body to fail to recognize self-protein as its own and to react to them as if they were foreign, resulting in autoimmunity and maybe autoimmune diseases. So, let's discuss about some autoimmune diseases. The autoimmune diseases can be divided into two categories. First one, organ-specific autoimmune disease, and second, systemic autoimmune disease depending on the tissues or cells affected. So, let's go detail to the organ-specific or localized autoimmune disease. As the name indicates, in this case, the autoimmunity involves a particular organ. In an organ-specific autoimmune disease, the immune response is directed to a target antigen unique to a single organ or gland, so that the manifestations are largely limited to that organ. The cells of the target organs may be damaged directly or humoral or cell-mediated effector mechanisms. Alternatively, the antibodies may overstimulate or block the normal function of the target organ. It can be also subdivided into two categories. Autoimmune disease, which is mediated by direct cellular damage, occurs when lymphocytes or antibodies bind to cell membrane antigens, causing cellular lysis and/or an inflammatory response in the affected organ. Gradually, the damaged cellular structure is replaced by connective tissue and the function of the organ declines. And the second, autoimmune diseases, which are mediated by stimulating or blocking autoantibodies. In some autoimmune diseases, antibodies act as agonists, binding to hormone receptors instead of normal ligand. So, let's discuss about some organ-specific autoimmune disease mediated by cell damage. Let's take example of Hashimoto's thyroiditis. Hashimoto's thyroiditis, also known as chronic lymphocytic thyroiditis, and it is an autoimmune disease in which the thyroid gland is gradually destroyed. In earlier period, it does not show any symptoms, but over time, the thyroid may enlarge, forming a painless goiter. And its symptoms are weight gain, constipation, depression, and general pains. After many years, the thyroid typically swollen in size. Potential complications include thyroid lymphoma. Next example is the Goodpasture syndrome. In this disease, autoantibodies specific for certain basement membrane antigens bind to the basement membranes of the kidney glomeruli and the alveoli of the lungs. Subsequent complement activation leads to direct cellular damage and ensuing inflammatory response mediated by a buildup of complement split products. Damage to the glomerular and the alveolar basement membranes leads to progressive kidney damage and pulmonary hemorrhage. And its important symptoms are: the first sign of Goodpasture syndrome may include fatigue, nausea and vomiting, difficulty in breathing, affects the kidneys. Symptoms may include blood in the urine, foamy urine, swelling in the legs, high blood pressure, burning or difficulty when urinating, and also back pain below the ribs. Next is the insulin-dependent diabetes mellitus, IDDM, which is commonly known as type 1 diabetes. It is caused by an autoimmune attack on the pancreas. The attack is directed against specialized insulin-producing cells, that is beta cells, and that are located in the spherical clusters called the islets of Langerhans, scattered throughout the pancreas. The autoimmune attack destroys beta cells, resulting in decreased production of insulin and consequently increased levels of blood glucose. Several factors are important in the destruction of beta cells. First, activated CTLs migrated into an islet and begin to attack insulin-producing cells. Autoantibodies to beta cells may contribute to cell destruction by facilitating either antibody plus complement lysis or antibody-dependent cell-mediated cytotoxicity, that is ADCC. The abnormalities in glucose metabolism that are caused by the destruction of islet beta cells result in serious metabolic problems that include ketoacidosis and increased urine production. The late stages of the disease are often characterized by atherosclerotic vascular lesions, which in turn cause gangrene of the extremities due to impeded vascular flow, renal failure, and blindness. If untreated, that can be the result. And its major symptoms are frequent urination, that is frequent bedwetting in children who have been toilet trained, excessive thirst, excessive hunger, weakness and fatigue, drowsiness, irritability, blurred vision or any change in sight, nausea and vomiting, and also sudden unexplained weight loss. And here is the skin disease caused by diabetes. Now let's come to the organospecific autoimmune disease mediated by stimulating or blocking autoantibodies. First one example is Graves' disease. The production of thyroid hormone is carefully regulated by thyroid stimulating hormone, that is THH, which is produced by the pituitary gland. Binding of THH to a receptor on thyroid cells activate adenylate cyclase and stimulate the synthesis of two thyroid hormones, thyroxine and triiodothyronine. A patient with Graves' disease produces autoantibodies that bind the receptor for THH and mimic the normal action of THH, activating adenylate cyclase and resulting in production of the thyroid hormones. Unlike THH, however, the autoantibodies are not regulated and consequently they overstimulate the thyroid. For this reason, these autoantibodies are called long-acting thyroid stimulating antibodies. And its symptoms are oversweating, weight loss, nervousness, hand tremors, anxiety and irregular or repeat heartbeat, and enlargement of the thyroid gland, that is goiter. Here shows the enlargement of thyroid gland in Graves' disease. Next, myasthenia gravis. It is the prototype autoimmune disease mediated by blocking antibodies. A patient with this disease produces autoantibodies that bind the acetylcholine receptors on the motor end plates of muscles, blocking the normal binding of acetylcholine and also inducing complement-mediated lysis of the cells. The resulting is a progressive weakening of the skeletal muscles. Ultimately, the antibodies destroy the cells bearing the receptors, and its symptoms are: the early signs of this disease include drooping eyelids and inability to retract the corners of the mouth, which gives the appearance of snarling. Without treatment, the progressive weakening of the muscles can lead to severe impairment of eating as well as problems with movement. And this picture shows myasthenia gravis symptom. Systemic autoimmune diseases type. In systemic autoimmune diseases, the response is directed towards a broad range of target antigens and involves a number of organs and tissues. These diseases reflect a general defect in immune regulation that results in hyperactive T cells and B cells. Tissue damage is widespread, both from cell-mediated immune responses and from direct cellular damage caused by the autoantibodies or by accumulation of immune complexes. Some examples of systemic autoimmune disease are systemic lupus erythematosus, multiple sclerosis, and rheumatoid arthritis, etc. Systemic lupus erythematosus. Systemic lupus erythematosus (SLE) typically appears in women between 20 and 40 years of age. The ratio of female to male patient is 10:1. Affected individuals may produce autoantibodies to a vast array of tissue antigens such as DNA, histones, RBCs, platelets, leukocytes, and clotting factors. Interacting of these autoantibodies with their specific antigens produces various symptoms. Autoantibody specific for RBCs and platelets can lead to complement-mediated lysis, resulting in hemolytic anemia and thrombocytopenia, respectively. When immune complexes of autoantibodies with various nuclear antigens are deposited along the walls of small blood vessels, a type 3 hypersensitive reaction develops. The complexes activate the complement system and generate membrane attack complexes and complement split products that damage the wall of the blood vessels, resulting in vasculitis and glomerulonephritis. Various occlusions of the small blood vessels develop, that is vasculitis, and its symptoms are: SLE is characterized by fever, weakness, arthritis, skin rashes, pleurisy, and kidney dysfunction. And this is the signs and symptoms of lupus. Another example is multiple sclerosis. Multiple sclerosis, MS, is the most common cause of neurologic disability. Individuals with this disease produce autoreactive T cells that participate in the formation of inflammatory lesions along the myelin sheath of nerve fibers. The cerebrospinal fluid of patients with active MS contain activated T lymphocytes which infiltrate the brain tissue and cause characteristic inflammatory lesions, destroying the myelin. Since myelin functions to insulate the nerve fibers, a breakdown in the myelin sheath leads to numerous neurologic dysfunctions. The symptoms of MS are: symptoms of MS may be mild, such as numbness in the limbs, or severe, such as paralysis or loss of vision. And another example is rheumatoid arthritis. It is a common autoimmune disorder. Many individuals with rheumatoid arthritis produce a group of autoantibodies called rheumatoid factors that are reactive with determinants in the Fc region of IgG. The classic rheumatoid factor is an IgM antibody with that reactivity. Such autoantibodies bind to normal circulating IgG, forming IgM-IgG complexes that are deposited in the joints. These immune complexes can activate the complement cascade, resulting in a type 3 hypersensitive reaction, which leads to chronic inflammation of the joints. The symptoms of rheumatoid arthritis include chronic inflammation of the joints as well as frequent effect on hematologic, cardiovascular, and respiratory systems. Let's come to the treatment of autoimmune disease. Since the cause of the diseases are not quite well understood, the general principle is to somehow stop the immune response to self-antigens, and this can be achieved by the following methods. Often in organ-specific autoimmune disorders, the symptoms can be controlled by administration of thyroxine and thyrotoxicosis by anti-thyroid drugs. In pernicious anemia, metabolic correction is achieved by injection of vitamin B12, and in myasthenia gravis by administration of cholinesterase inhibitors. Conventional immunosuppressive therapy with antimitotic drugs at high doses can be used to damp down the immune response, but because of the dangers involved, tends to be used only in life-threatening disorders such as SLE. The potential of cyclosporin and related drugs such as rapamycin has yet to be fully realized, but quite dramatic results have been reported in the treatment of type 1 diabetes mellitus. Anti-inflammatory drugs are prescribed for the rheumatoid diseases with the introduction of selective cyclooxygenase 2 COX-2 inhibitors, representing a good development. Conclusion: due to certain abnormality in the normal immune system of the body, it leads to self-tolerance and induction of an immune response against components of self causing certain autoimmune diseases like Graves' diseases, diabetes, systemic lupus erythematosus, multiple sclerosis, etc. These autoimmune diseases can be caused by many factors like environmental factor, infection, drugs, toxin, hormone, and occurrence of mutation in associated genes. Current therapies for autoimmune diseases include treatment with immunosuppressive drugs, vaccination with T cells specific for a given autoantigen, administration of synthetic blocking peptides that compete with autoantigen for binding to MHC molecules. Such treatment were found to be very effective in controlling the autoimmune disease. Individuals can also take precautions from causing such disease by not exposing themselves to such environmental factors like drugs, toxin, etc. Thank you.